So the Women in STEM Award supplemented an existing National Institutes of Health grant to conduct research on whether mindfulness-based interventions are effective for helping people reduce their drinking, and to see if we could augment or boost the effects of mindfulness-based intervention using brain stimulation. So providing kind of small electrical current to the brain while individuals were engaged in mindfulness practices. And so the idea with mindfulness-based interventions is that we can train ourselves, our brain, to be more in the moment and to be more aware and open and non-judgmental of what's happening in the current moment. And so we've used this often with substance use disorders, including alcohol, as was the focus of the Women in STEM Award, because we have found that people kind of in the development of an alcohol or substance use disorder, their brain almost becomes kind of rewired towards those substances and towards living not in the moment. And so we have found that using mindfulness practices can help individuals be okay with the current moment and sit with distress and sit with urges and not have to drink or use drugs to cope. The Women in STEM Award helped us purchase devices that we were then able to use in our study. Second, it allowed us to have a bigger group size because we run these mindfulness training programs in groups. And so we actually did brain stimulation and mindfulness training in a group setting. And by having more devices, we were able to actually have larger group sizes, so more people being treated at a time. New Mexico has the #1 rate in the country of alcohol-related mortality. And so we really need to develop new and more effective interventions to help people with alcohol use disorder reduce their drinking and to provide alternative options to what already exists in the community. And so this Women in STEM Award and this particular research was really designed around improving alcohol treatment for people who wanted to reduce their drinking.